Hello, I am Dr. DeAndre. Today, I will talk about the top 5 cancer screening tests every adult needs. Cancer remains one of the leading causes of death globally, responsible for nearly 10 million deaths each year. One of the most critical facts in modern medicine is that early detection significantly increases survival rates. Many cancers develop silently, without noticeable symptoms in their early stages. This means individuals may feel completely healthy while disease is already progressing internally. Scientific evidence consistently shows that cancers detected at an early stage are far more treatable, often requiring less aggressive therapy and offering better long-term outcomes. In contrast, late-stage cancers are more difficult to manage and are associated with significantly lower survival rates. Screening tests are designed to detect abnormalities before symptoms appear, allowing healthcare providers to intervene early. In this video, I will explain the most important screening tests every adult should consider, including how they work, who needs them, and what the latest medical research tells us about their benefits and limitations. Cancer screening is a preventive medical strategy that involves testing individuals who do not yet show symptoms of disease. The primary goal is to identify cancer at an early stage when treatment is more effective. Research in oncology has demonstrated that early-stage cancers often have survival rates exceeding 90%, while advanced cancers may have survival rates below 30% depending on the type and location. Screening does not directly prevent cancer in most cases, but it allows for early detection, which can significantly reduce mortality. Some screening tests, such as colonoscopy, can also remove precancerous lesions, effectively preventing cancer from developing. This dual role makes certain screenings particularly powerful. Large population studies have shown that routine screening programs can reduce cancer-related deaths by 20 to 60%, depending on the cancer type and adherence to guidelines. However, screening also has limitations. False positives can occur, meaning the test indicates a possible cancer when none is present. This happens in approximately 5 to 10% of screenings, depending on the method used. False positives may lead to additional tests, which can cause temporary anxiety and discomfort. There is also the possibility of overdiagnosis, where slow-growing cancers are detected that may never cause symptoms during a person's lifetime. Despite these limitations, the benefits of screening generally outweigh the risks, especially for individuals in recommended age groups, or those with risk factors such as family history, smoking, or obesity. It is important to follow evidence-based guidelines and consult a healthcare provider to determine the most appropriate screening schedule. Breast cancer is the most commonly diagnosed cancer among women worldwide, making regular screening essential for early detection. Mammography is the primary screening tool and uses low-dose X-ray imaging to detect abnormal growths within breast tissue. These abnormalities are often too small to be felt during a physical examination, which is why imaging plays a crucial role. Medical guidelines recommend that women between the ages of 40 and 74 undergo mammography every 1 to 2 years, depending on individual risk factors. Women with a strong family history or genetic predisposition may need to begin screening earlier or undergo additional imaging, such as MRI. Clinical research has demonstrated that mammography reduces breast cancer mortality by approximately 20% to 30%, making it one of the most effective screening tools available. During the procedure, the breast is gently compressed between 2 plates to obtain clear images. This compression may cause mild discomfort but is necessary for accurate results. The test is quick, usually completed within 10 to 15 minutes, and radiation exposure is minimal and considered safe for routine use. There are some limitations. Approximately 10% of mammograms may require follow-up imaging due to unclear findings. False positives can occur, leading to additional tests, such as ultrasound or biopsy. Overdiagnosis is also possible, where non-aggressive tumors are detected and treated unnecessarily. Despite these limitations, the benefits of early detection are substantial. Early-stage breast cancer often requires less invasive treatment and has significantly higher survival rates. Women should discuss their personal risk factors with a healthcare provider to determine the most appropriate screening schedule. Colorectal cancer affects the colon and rectum and is a major cause of cancer-related deaths, particularly in adults over the age of 50. Screening is highly effective because it can detect cancer early and also identify precancerous polyps, which can be removed before they develop into cancer. Colonoscopy is considered the most comprehensive screening method. It involves the use of a flexible tube equipped with a camera that allows direct visualization of the colon. Guidelines recommend starting screening at age 45, with repeat colonoscopy every 10 years if no abnormalities are found. Studies have shown that colonoscopy can reduce colorectal cancer mortality by up to 60 to 70%. Preparation for the procedure involves cleansing the bowel using a prescribed solution. This step is essential for ensuring clear visibility during the examination. The procedure itself is typically performed under sedation, so patients are comfortable and do not experience pain. Risks are minimal but include bleeding or perforation of the colon, occurring in less than 1% of cases. Alternative screening options include stool-based tests, which detect hidden blood or abnormal DNA. These tests are less invasive but must be performed more frequently and are less accurate than colonoscopy. Lifestyle factors also play a role in colorectal cancer risk. Diets high in processed meats and low in fiber are associated with increased risk, while regular physical activity and a balanced diet can reduce risk. Screening remains the most effective strategy for early detection and prevention. Cervical cancer screening focuses on detecting abnormal cell changes in the cervix before they develop into cancer. The two main tests are the Pap smear and the HPV test. The Pap smear identifies abnormal cervical cells, while the HPV test detects high-risk strains of the human papillomavirus, which is responsible for nearly 99% of cervical cancer cases. Screening is recommended for women aged 21 to 65. Pap smears are typically performed every 3 years, while HPV testing may allow for longer intervals of up to 5 years if results are negative. These screenings have significantly reduced cervical cancer mortality by more than 50% in populations where they are widely used. The procedure involves collecting a small sample of cells from the cervix using a soft brush. It is quick and usually causes only mild discomfort. Results help identify changes at an early stage, allowing for treatment before cancer develops. False positives can occur, leading to additional diagnostic procedures, such as colposcopy. However, early detection of abnormal cells provides an opportunity for effective intervention. Vaccination against HPV is another critical preventive measure. It protects against the most common cancer-causing strains of the virus and is recommended for both females and males in many healthcare systems. Combining vaccination with regular screening provides the highest level of protection. Prostate cancer is one of the most common cancers affecting men, particularly those over the age of 50. The PSA test measures the level of prostate-specific antigen in the blood. Elevated PSA levels may indicate cancer, but they can also be caused by benign conditions such as prostate enlargement or inflammation. Screening is generally recommended for men aged 50 to 69, although those with higher risk, including family history, may begin earlier. Studies suggest that PSA screening can reduce prostate cancer mortality by approximately 20%. But the benefits must be balanced against potential risks. One of the main concerns is overdiagnosis. Some prostate cancers grow very slowly and may never cause symptoms or affect lifespan. Detecting these cancers can lead to unnecessary treatments, which may have side effects such as urinary incontinence or erectile dysfunction. If PSA levels are elevated, further evaluation may include imaging or biopsy. Biopsy carries small risks, including infection or bleeding in about 1–2% of cases. For this reason, shared decision-making between patient and physician is essential. Men should discuss the potential benefits and risks of screening to make an informed choice based on their individual health profile. Lung cancer is the leading cause of cancer-related death worldwide, largely due to late diagnosis. Low-dose computed tomography, or CT scan, is the recommended screening tool for individuals at high risk, particularly long-term smokers. Screening is advised for adults aged 50 to 80 with a significant smoking history. Clinical trials have shown that low-dose CT scans can reduce lung cancer mortality by approximately 20 to 25% by detecting tumors at an earlier stage. The scan produces detailed images of the lungs and can identify small nodules that may indicate cancer. The procedure is non-invasive and typically completed within minutes. However, false positives are relatively common, occurring in up to 25% of initial screenings. This may lead to additional imaging or procedures to confirm findings. Radiation exposure is low but higher than standard X-rays. The most important preventive measure remains smoking cessation. Screening is most beneficial for those at highest risk. and should be combined with lifestyle changes to reduce overall cancer risk. Cancer screening plays a vital role in modern healthcare by enabling early detection and improving survival outcomes. Mammography, colonoscopy, pap smear, PSA testing, and lung CT scans are among the most effective tools available today. Each test has specific guidelines based on age and risk factors, and understanding these recommendations is essential for making informed health decisions. Always consult your physician before starting or changing any screening plan. Early action can save lives. If you found this information helpful, consider sharing it and subscribe for more evidence-based medical education.